Hi, I'm Dr. Brian Gervais. Today we're going to be utilizing active release techniques here with Kathy. She came in presenting with carpal tunnel symptoms just a couple days ago. And what we're going to be doing here, let me explain to you what she's experiencing. Getting some numbness and tingling down here and through the arm, actually on the front side, down into these fingers down here. She doesn't remember any specific trauma or incident that might have caused this, but she does work at a computer all day long, so sitting at the keyboard, she could be compressing the forearm muscles up here, or even her posture is taking a toll on her up here with the neck and all these nerves that come right down the neck, through the arm, down into the wrist. One specific nerve that we're going to target right now is the median nerve, which is specific for carpal tunnel syndrome, and it can get entrapped up in here in the neck muscles, down through here, right at the elbow joint, and down at the actual carpal tunnel in the wrist. So we're going to check all these areas to make sure that we're not missing, where the entrapment could be. It could be here, it could be here, it could be here. So we're going to check all of those. So basically, let's start at the elbow, because this is one of the most common places we see it entrapped here in the pronator teres muscle. So what we like to do is shorten the structure and then put it through its full range of motion. And what I'm feeling for is the nerve to slide underneath my fingers, and while I take her fingers and bend them back, we should feel no resistance. If we feel some resistance, typically right up in here, the nerve is developing a little adhesion against the muscles, so the muscle is kind of entrapping it there, giving us that symptom of numbness and tingling down into the hand. And Kathy does have quite a bit of tension here built up at the insertion of all these muscles here at the elbow. So another way that this develops is just persistent use of the wrist like this, because all this activity with the fingers flexing forward is done by all the muscles here of the anterior forearm. So she's been sitting at the computer for probably 20 plus years. It's taken a toll on her. So right down here is the actual carpal ligament, right where the median nerve, the carpal tunnel nerve, comes down to the fingers. So, and I can feel that there's a lot of tension here. So what we try to do is make 4 or 5 passes, loosen it up, and see if that improves with the symptoms. And if we are reproducing the symptoms while we're doing this action, do not be alarmed. All that means is that we are in the right area and that we've hit the specific tissue that needs treatment. She should feel an increased range of motion in the wrist, the flexibility in the little bones of the wrist down here in the ligaments. Also, the muscles of the elbow, after being worked like this, should move much more freely.
It feels better already.
Many patients experience symptomatic relief, 1 to 2 visits, but complete resolution usually takes anywhere from 3 to 6, 4 to 8 visits, depending on how long you've had the problem and what you've been doing for it.